Hello everyone, good day. So I am Baby Japanada, and for today we are going to discuss about the unit 4 lesson 6, which is autism. So let's start. So what is autism? So it is a spectrum disorder. It is a lifelong disability, most commonly to boys. Males are 4 times more likely to have autism than female, and autism means developmental disability which affect verbal and nonverbal communication and social interaction. Autism comes from the Greek word "autos," the word autistic meaning to escape from reality was first used by Leo Kanner in 1943 when he identified the symptoms characterized by autism. So autism, it is a spectrum disorder, or ASD, is a developmental disability caused by differences in brain. Next is we have classification. So autism is classified into mild, moderate, and severe. Those who are classified as mild and moderate are called high functioning. Only few of this population have special skills in numbers, memory, art, music, and reading. So in the past day, were described the French term idiot servants, which means unlearned skills. So one example of servant skills is hyperlesia. So this is the ability to read without someone teaching the person to read. So today we use the term savant to describe individuals with autism who have extraordinary skills or talent specific areas such as mathematics, music, arts, or as you mentioned, hyperlesia. So it is important to note that not all individuals with autism have seven skills, and seven disabilities can vary widely among those who do. So hyperlesia is subtype of seven skills where a person demonstrate an early and strong ability to read, often well before the typical age, and for reading developmental. However, individual with hyperlesia may struggle with comprehension, meaning they can decode and recognize word, but may have difficulty understanding the content or context of what they are reading. We have characteristics. So the Diagnostic and Statistical Manual or Mental Disorder, or DSM-IV 2000, has the following description for autism. So first is we have impairment and social interaction. So first is we have prefer to play or spend time alone. So individual with autism may exhibit a preference for solidarity activity rather than engaging in social interaction. They may find comfort or enjoyment in independent play. So next is we have show little interest in making friends. So socializing and forming friendship may not become naturally for individual with autism. They may struggle with or lack interest in typical social cues and norms that guide social interaction. So C, we have has difficulty keeping friends. So um, establishing and maintaining friendship can be challenging for individual with autism due to difficulties in understanding social nuances, reciprocal communication, and shared interests. So next is we have D, lack eye contact, facial expression, or gesture. So many individual with autism may have challenges with ner- um, nonverbal communication. This can manifest as limited eye contact, facial expression, or gesture, which are crucial component of difficult social interaction. So next is we have may not respond when name is called. So some individual with autism may not consistently respond to their name being called. This could be related to challenging progressing auditory stimuli or difficulties in shifting attention from one stimuli to another. Next is we have dislike being touched or resist cuddling. So sensory sensitivities are common in autism, and some individual may find certain type of physical contact such as cuddling or touching uncomfortable or distressing. So next is we have does not seek or accept comfort when hurt. So, individual with autism may not instinctively seek or accept comfort in the same way that a neurotypical individual may when they are hurt or distressed. So, this can be related to differences in emotion regulation or sensory processing. So next is we have unaware or disinterested in what is going on around them. So some individual with autism may appear disengaged or uninterested in their surroundings. So this could be due to differences in attention regulation, sensory progressing, or focus on a specific interests to the inclusion of other stimuli. Next is we have struggle imitation or social imitative play. So, difficulty imitating other or engaging in social play impact interaction with peers. So, next is we have two, empowerment and communication. So, um, we have a delay in or total lack of spoke language. So, individual may experience a delay or developing spoken language or may not develop verbal communication at all. So, B is we have inability to initiate or sustain conversation. So, challenging in starting and maintaining conversation, including difficulties in understanding social cues and responding appropriately. So next is we have a struggle imitation or social imitative play. So in struggle with imitating social imitative play is they have difficulty in imitating others or engaging social play, impacting interaction with peers. So next is we have empowerment and communication. So delay in or total lack of spoken language. So here is individual may experience a delay or developing spoken language or may not develop verbal communication at all. So next is we have children or individual with adequate speech or inability to initiate or sustain conversation. So um, this here is challenging in starting and maintaining conversation, including difficulties in understanding social cues or responding appropriate. So in letter C naman is repeat the same word or phrase over and over. So um, here is repetition of word or phrase either immediately or after some time, which can be serve various purposes such as self-stimulation or communication. So next is we have repeat word, phrase, or sentence heard in the past. So here is repetition of language from the past reflecting a form or repetitive speech seen in individual with autism. Next is we have cannot express clearly what he wants. So um, here is difficulty in articulating needs or desire in clean and effective manner, leading to potential or frustration. Next is we have has difficulty imitating or subtaining conversation. So um, here is some individuals start struggling in starting and maintaining conversations stemming from challenging challenges in social understanding and communication. Next is we have mixed verbal sound while listening. So some uh, some of them production or vocalization or sound while listening serving different purpose such as self smoothing or expressing emotion. Next is we have rarely ask questions and has difficulty answering question. So some individual with autism has difficulty in asking and responding to question linked to challenges in understanding the social function or question and formulating appropriate response. So last is we have in G is appears deep. So they are lack of responsiveness or responsiveness to auditory stimuli such as spoken instruction, giving the appearance of deafness, thought this is often a communication difficulty um, rather than an actual hearing impairment. Next is we have impairments in behavior. So A, we have preoccupation and attachment with particular objects. So individual with autism may show interest, focus, or attach to a specific object, often through the inclusion of other interests. So next is we have repetitive movements such as arm flapping, head banging, twirling, spinning, running around circle, and twisting or finger. So some of them engaging in repetitive movement in common behavior in autism. So this repetitive action can serve various purposes, including self-soothing or sensory stimulation. Next is we have like monotony or routine activities. So, individual with autism often prefer predictable routines and may become distressed when routines are distract or predictability can provide a sense of comfort or security. Next is we have likes feels the need to fix or rearrange things. So, some individuals with autism have a strong desire for order and may feel compelled to arrange objects in a specific way. So, changes to this order can cause distress. So, next is we have extreme fear with no apparent reason. So, individual with autism may experience heightened or anxiety of fear in response to sensory stimuli or environmental challenges that may not be apparent to others. So next is we have cause injury to self or others. So in some cases, individual with autism may engage in self-injury behavior or exhibit aggression towards others. So this behavior can be um, manifestation or communication difficulty or sensory challenges. Next is you have difficulty waiting for their turn. So, impaired patient and difficult to waiting for turn taking, which can be challenging in social or group setting. So next is you have display frequent temper tantrums. So difficulty regarding regulating emotion can lead to frequent temper like tantrums, especially when routine are disrupted or communication challenges arise. Next is we have hyperactive or lethargic. So, individual with autism may exhibit either hyperactive or lethargic behavior. So, some may be constantly on the move while others may appear disengaged or less active than expected from their age. So, these behavior are part of the characteristic of autism spectrum disorder can be vary widely among individuals. So, understanding and addressing this behavior often require individual strategy tailored to the unique needs of each person with autism. We have impairment and sensory progressing. So, here is we have oversensitive to touch. So, some individuals with autism may have hypersensitive to tactile stimuli, finding certain texture, clothing, or physical contact uncomfortable or distressing. So, next is we have no reaction to pains, sight, hearing, touch, or smell, or even taste. So, in contrast to hypersensitive, some individuals with autism may exhibit hypersensitivity, meaning they may not have they may not react to stimuli in the same way or neurotypical individual do. This can include reduced responsiveness to pain, visual, auditory, tactile, or olfactory or gustability stimuli. Next is we have a um, what we call excessive focus on details. So, individuals with autism often demonstrate a strong preference for details and may become interested focus on specific aspect of stimuli, object, or topic. So, next is you have very good in observing minute details. So, while there may be challenges in progressing and responding to sensory stimuli or in a typical manner, individuals with autism often excel in noticing and remembering intricate details that may go unnoticed by others. So, these sensory progressing differences are integral to the autism spectrum and contribute to other unique ways individuals with autism experience and interact with the world. So, strategies that accommodate and support sensory progressing um, preference are often employed to enhance individual comfort and well-being. Next is we have a cause of autism. So, theory of autism in the past, many researchers attribute autism to different causes by Gregorio 2009 discussed the several of the theories. So, one of the most popular in the about mothering is known as the psychogenetic theories of autism. According to the theory, the parents, especially the mother, and causing their child autism. It also explained that psychological bonds were not established between parents and child. The children would fail to establish relationship with other and failure to progress. So, in this uh, the bad mother theory categorized under psychogenetic theories of autism was historical perspective that gained attention to the past, according to Bergelio in 2009. So, this theory suggests that autism could be attributed to adequate parenting, particularly focusing on mothers. So, according to this theory, if mothers failed to establish proper psychological bonds with their children, it was believed that the children would subsequently struggle to form relationship with others and experience developmental delay. So, in essence, the mothering theory places blame on parents, particularly mother, for their children autism. So, it suggests cause link between the quality of parent-child relationship and development of autism. So, it's crucial to note that this theory has been widely discredited and it's not supported by contemporary research. Is we have genetic factors. So, at present, scientists and researchers still are not sure on the cause of autism, but based studies, it says that genetic environment are the reason of this condition. In the website of National Institution or Neurological Disorder and Stroke, they discuss a strong link between autism and genetic. Researchers believe that some people have strong genetic predisposition. So, in genetic predisposition, many students have indicate or heredity component in autism, which with higher likelihood of ACD in families with a history of the condition. So, researchers have identified various genes associated with autism, and certain genetic variation appear to contribute to an increased risk of developing ASD. We have environmental factors. So, National Autism Associate believe that a parent age can cause autism. This explained that when a woman reaches the age of 40, she has great chance to conceiving a baby with this condition compared to the young counterpart. So, this organization also believe that the babies that have been exposed to cigarette, alcohol, and medicine such as valproate acid and Tylom, ty, thalidomide during pregnancy has higher risk of autism. They also suggest that children born to mother who live within 1,000 feet of freeway have twice the risk of autism. So, sabatable naman siya. So, some of as what we observe nowadays, some of the children with autism is naa sila murag angkos silang autism kay some of their mother is they use cigarettes when they are when the baby is in their tummy. So that is why some of children with autism ang cause ana nila is naa sila ang cause is tungod kay ang ilang parents is gatake og mga ingani nga mga kuan like mga cigarettes, alcohol mo na siya makakos pod sa autism. Mo na siya ang gakos nga nung naa sila autism. So next is we have TIACHC. So Susan Stroke and Autism Constant mention in her website the structured teaching invention as one of the teaching techniques in model. It was introduced by Eric Scopper in the late 1970s from the University of North Carolina, or TEACCH division, which is treatment and education of autism and related communication handicapped children. Next, we have physical organization. The physical layout of the classroom is important. Most children with autism have sensory problems. By setting a physical organization such as providing um, clean area and boundaries for specific activities inside the classroom can help the student remember the activities that take place in each area. Also, a clear physical organization can also help minimize the visual and auditory distraction. So, next is we have A. Provide furniture in the classroom that is child friendly and age appropriate. So, here is choose furniture that is comfortable, safe, and suitable for the age group. Also ensure that furniture arrangement allow for easy navigation and clear pathway. So next is we have make material needed easily accessible to the child. So we need to organize material in a way that is visual, clear, and easily reachable for the student. Also, we need to clear level storage area and use visual cues to help student locate and access material independently. So next is we have limit the amount of visual clutter such as project and seasonal decoration. So we need to minimize unnecessary visual distraction in the classroom to reduce sensory overload, or we need to consider using neutral or calmness colors scheme and avoid excessive decoration that may be overwhelming. So next is you have or store or cover the necessary equipment and materials. So we need to keep the environment organized by storing or covering equipment and materials that are not currently in use. So we need to this help reduce visual and auditory distraction, promoting a more focuses and structured learning environment. This you have A. Paint the wall of the classroom with mute colors such as white or beige. F is control the amount of light inside the classroom by using curtains and blinds. So G is we have controlled the amount of auditory distraction by turning off the paging system using carpet or covering the wall with foam to mute the sound. Next is we have work system. Likewise, Eric Skopler, 1927 to 2006, and his college explained that importance of work system for children with autism. Through this technique, the student will guide by visual cues what and how much activities should be done independently. It also helps the student to monitor their tasks and sensory competition. We have task organization. So let's component in a task organization according to Scopper and co-researcher. They point out that the organization or task determine the student can work independently, how our tasks need to be accomplished, how it unit item must be complied and the final outcome. So task organization is a critical element in education as it impacts student ability to work independently, comprehend tasks requirements, follow completion procedures, and ultimately achieve the desired educational outcome. I'm, and also a well-organized approach to tasks contribute to positive learning experience and development of important of skill for students. Since we have a alternative and augmentative communication. So, according to National Autistic Society and Research Autism, alternative and augmentative communication is a form of communication used by people who are unable to use standard form of communication. So, alternative communication is replacement for standards communication, while the augmentative communication enhances the communication that the person knew. So, when we say argumentative and alternative and argumentative communication, or AAS, is a crucial area of support for individuals who face challenges in using standard form of communication. So, according to the National Autistic Society and Research Autism, or AAS, encompasses that method of tools designed to access people who are unable to rely or treat traditional models communication. There are two main components of AAC: alternative communication and augmentative communication. So when we say, wait, excuse me. Okay. Okay, so when we say alternative communication, it involves the use of methods other than spoken language or traditional form of communication to convey thoughts, needs, and ideas. So, for example of alternative communication is um, methods include gestures, sight, language, communication board, and electronic device that generates generate speech. So when we say also argumentative communication is aimed to engaging or supplementing existing or communication abilities rather than replacing them. So we have facilitated communication or support. TED typing is a form of alternative and argumentative communication. In this strategy, a facilitator of the communication body will physical support the person with autism, demonstrate that he likes to communicate by pointing the pictures, symbol, letters, or word from him. This form of communication is usually combined with sign language. So, as what I have said, they use they use um spoken language, traditional form, communication, and so on and so forth. So, in five is we have also behavioral intervention. The National Autism Society and Research Autism differentiate behavior and developmental intervention. They explain that behavior intervention encourage appropriate behavior and discourage inappropriate also behavior. So that will be all to my part. Thank you.
Okay, and now let's move on to the next topic, which is the discrete trial teaching, or the DTT, meaning it is a teaching method where the teacher works one-on-one with students in structured setting. During each session, a series of planned learning Activities are presented one at a time. Example, imagine a teacher and a student sitting at the table. So, naisa ka estudyante and of course, anang estudyante is na autism and a teacher of course. So, they sit together and gitudloan siya sa iyang teacher. Nag-introduce ang teacher of specific task or activities through a step-by-step manner. So that makafocus sa ilahang skill at a time. Ano siya? Discrete trial training, meaning to say, is a one-on-one session between the student and the teacher. Also, Smith cited in educ104 website, uh, i-describe niya ang discrete trial teaching nga it's a method of teaching in simplified and structured steps. Instead of teaching the entire skills on one ego, the skill is broken down and built using discrete trials that each step one at a time. So, ato siya, gibahin-bahin mo siya, dili mo siya kanang uh, larguhon og tudlo since ang bata is dili siya normal just like us and na siya autism, so dili nimo kailangan i-focus good kanang ilargog tudlo ang tanang lesson. Next, we have discrete trial example. First is that a teacher shows one circle and one triangle on the table in front of the child. Next, we have teacher says point the circle. The child responds by pointing the circle. And then the teacher says, oh, very good. A new discrete trials begin. So, dili mo siya kailangang from this example, step by step niya ang process. Dili mo kailangang i-dungan ka na. And then, discrete trial or the DTT has 6 parts, namely the antecedent, prompts, response, consequence for correct response, consequence for incorrect response, and inter-trial interval. Yan. So prompts are usually way to start teaching a behavior based on the discussion of kinsa ganito, based on the discussion of Smith sa Texas Statewide Leadership for Autism. And then here we go, the types of prompts. First, we have the full physical assistance, meaning to say that assisting the learner to pick up a cup. The teacher must take the child's hand and guide him in picking up. So, kailangan sa fully physical assistance, ang teacher is mag-assist sa learners nga kuhaon ng cup through guiding the hand of the learner sa pag pick sa cup, from the word physical assistance. Next, we have the partial physical assistance, assisting the learners to pick up a cup by guiding the child's hand to pick up to the cup by tapping his elbow. So sa physical full physical assistance is i-guide nimo ang hand mismo sa bata, where in sa pag-abot sa partial physical assistance is dili na nimo siya i-guide. I know, although i-guide mo siya, pero dili na pinagi ka ng whole nga assistance ang imong ihatag, kundi through by tapping only the elbow. Next, we have the full model, meaning to say, assisting the learners to clap by performing clapping while telling the child to clap. So, full model meaning to say, lihokon siya mismo. So, while gina-assist mo ang bata na may autism, learners how to clap since gina-assist pa man sa unsaon pag-clap. So, alang namang mo ingon dahil ka sa bata nga, oy, clap without para nang wala siya kabalo sa akong pag-clap. So, um, teachers would assist learners how to clap, of course, through performing how to clap so that pag makabalo ng bata, that is clap pala pag magganon-ganon ang hand. So, that is clap. Yan, ganon. Next, we have the partial model. Assisting the learners how to clap by putting his hand in front of him does not actually clap. So, sa full model, i-assist din mo siya how to clap through performing, of course, how to clap. Where pag abot sa partial model is, i-assist lang ni mo gyapon ng learner how to clap by putting his hands in front of him pero dili siya mo clap. Next, we have the four full verbal prompts. The teacher expressively label car. The teacher asks, "What is it?" And then ang bata mo say, "Oh, car." Let's say mo, ang teacher mo putong image of a car. And then label nila, "Oh, this is a car." So, pag mamunta ng teacher, "What is that?" Of course, mayroon ang bata, "Oh, it's a car." Yan. Sixth, we have the partial verbal prompts. The teacher expressively label car. The teacher asks, "Why is it?" Ganon siya. Seven, we have the gestural prompts, teaching the function of an object. And then the teacher says, "What do you drink with?" while holding his hand to his mouth, shaping it like a cup. And then last, we have the positional prompt, meaning is to assist the child to label toy. And then the teacher places a toy closest to the child. Next, we have the pivotal response training. Okay. Uh, Pivotal response training was developed by Robert Kogel and Lynn Kernel Kogel. These are educational psychologists during 1970s at the University of California. Meaning to say that it allows the child to choose materials during activities to give them a sense of engagement. Ayan. And then, combine previously learned tasks with new ones. Mix things the child has already learned with new things to make them feel successful in their learning. Next we have encourage the child from the moment he attempts to respond. So you support and cheer on the child as soon as they try to respond or participate during the class discussion. Next, we have used natural direct reinforcement. You reward the child with something they naturally enjoy when they complete a task. That is reinforcement. It is a positive reinforcement. For instance, if they ask for a toy train, playing with the train becomes their reward. Of course, in other words, pivotal response training is a way of teaching that lets children choose what they want to learn. It mixes things they know with the new task to make learning fun and successful. The teacher encourages and rewards the child through reinforcement, of course, for trying and uses things the child likes as reward. So this method is all about making learning enjoyable and connecting it to things that naturally interests the child. Next, we have the sensory basis intervention. Now, sensory basis intervention is an approach developed by John Ayres a licensed clinical psychologist and occupational therapist in 1917. It uh, focuses on addressing sensory deficits in individuals, especially those referring to an autism, particularly those with autism. Yeah, in areas like touch, sight, hearing, smell, and body movement awareness. So, for example, imagine who is who's someone. Imagine someone who is very sensitive to touch, sounds, or smell. This can make it challenging for them, of course, to have a appropriately learn because their brain struggles to process sensory information normally kasi nga meron silang sensitivity in terms of touch, sound, or smell. So, pag nadyo sila yung ana, maglisod ang bata, labi na na siya yung autism, maglisod siya process sa learning niya kay mabother man sa ana ng mga sensitivity. Ayan. Now, we have types of sensitivity uh, and to address this one. First, we have the tactile or touch, weighted vests, weighted blanket, resistive putty, handle fidgets, holding something cold, writing in sand or salt. So through doing this, maybe ma-relieve ang sensitivity what do you call naman, sensitivity problem sa isa ka bata nga naay autism. So it addresses sensory challenges related to touch. Next, we have the vestibular or the balance, meaning to say it focused on sensory aspects related to balance and body movement, especially sa naay autism. For example, pwede siya mo hang upside down, jumping on a trampoline, swinging on a swing, swirling, spinning, rocking on a rocking chair, or sitting on a therapy ball na mag sorry, mag in other things na related to the balance. Next, we have the proprioception or the body awareness, meaning to say it addresses how the body understands its own position and movement. For example, performing exercises, handling heavy objects like books, or running errands. Next, we have the visual, of course, sight, makita na to through the use of our eyes, meaning that they were dealing with sensory challenges related to sight and light. Maybe bislawan sila ba or something. Sa sight naman, maybe blur or sana. Example, adapting the environment by turning off the lights using sunglasses, wearing a cap with brim, using an elevated slant board, or using highlighting pen and a study rail. So this examples can prevent or intervent them sa ilahang mga sensitivity problem. Next, we have the auditory or the hearing, meaning it addresses issues related to hearing and auditory processing in a child, of course, with an autism. For example, using a talking calculator, listening to music, using earplugs and earphones, playing with chimes, squeezing toys, or listening to a book tape. Next, we have the gustatory or taste. This type of sensory problem, no, deals with the sensory challenges related to taste. Example, sucking a thick liquid through a straw, blowing bubbles, playing a musical instrument, drinking cold water, or eating crunchy foods. Next, we have the olfactory or the smell. It addresses sensory issues related to smell. So, para ma-address siya, the child with an autism can use a nose plug, scratch and snip stickers, scented candles, or scented pens or markers. So, all in all, sensory-based intervention involves using specific activities or tools that help individuals who face challenges, especially those who have autism, in how they sense and process touch, balance, body awareness, sights, hearing, taste, and smells. Examples including things like using weighted vests, swing on a swing, wearing sunglasses, or listening to music to make the environment more comfortable for them. So, of course, these interventions are tailored to each person's sensory needs to support their well-being and learning. Yan. Next, we have the emotional or developmental model. Floor time. By the way, what is this floor time? Ayan. Floor time is a play-based interactive intervention that was created by Greenspan Wither. Ayan. Okay. Its goal is, of course, to boost socialization, enhance language skills, and reproduce repetitive behaviors in children. For example, imagine an adult is spending 20 to 30 minutes getting down, sitting on floor, actively engaging with a child through a play. This method emphasizes the importance of adults actively participating in play to encourage interaction. Yan. Oops. Of course, to better understand what is floor time, let us discover its key points. Play-based interaction using plays, meaning to say using plays as a way to connect with and teach with children. In other words, again, for the emotional or developmental model, is specifically the floor time. It is a way of teaching and connecting with children through interactive play. It involves an adult spending time on the floor, actively engaging with the child for 20 to 30 minutes. And this method is designed to improve their social skills and enhance language development and reduce repetitive behaviors in children. This approach emphasizes the value of play time between adults and children as means of promoting healthy emotional and developmental growth. Yan. Next, we have the social narratives. Ayan. Social narratives meaning these are tools designed to help individuals, especially with autism, develop social skills. They aim to teach social behaviors explicitly. For example, in a social stories, it was developed again. Social stories was developed by Carol Gray in 1991. It focuses on various aspects, including social skills, health skills, academic abilities, develop self-esteem, help a person to cope with change in routines and unexpected events. Next, we have the comic strip. The comic strip is a visual representation of conversation using stick figures, symbols, and colors. It includes dialogue, feelings, and intention of people in the conversation to help children with autism gain social understanding. Ayan. Next, we have the power card. A power card is a strategy developed by Gagnon in 2001, where a short script is written in the first person on a card with colored illustrations or photographs. It is tailored around the student's special interest. So to elaborate more about social narratives, let's explore these key points about social narratives. For expliciting teaching of social skills, it aimed at teaching social skills explicitly to individuals, particularly those with autism. Ayan. For the comic script naman, for social understanding, of course, comic strip provides a simple visual representation to enhance the social understanding of the child, especially with autism, through incorporating elements like dialogues and emotions. And then for the power card strategy, it involves creating short scripts on cards with illustrations or photos that are centered around students' special interest. So to sum it up, social narratives, including social stories, comic strips, and power cards, are tools to help individuals, especially with autism, learn social skills explicitly. Social stories cover various aspects, while comic strips visually represents conversation, and power cards, of course, uses a student's special interest to teach social behaviors. These tools use simple and visual approach to make learning about social situation more accessible and engaging for individual with autism. And that's it for our report about autism. Thank you and God bless.